ready to start the healing process here, the submersion into, for 46, 47 degrees Fahrenheit here. So the ice bath is done to help, once again, facilitate the healing process. We've been training pretty hard the last week. We've been training for a long time, of course, but we're in that roughly 10-week prep period now for our contest, middle of May. So I'm going to slowly get in. As you can see, I'm wearing some clothing here just to kind of shield the skin directly. And I'm going to try for anywhere between a minute to 5 minutes. They recommend just starting out until you get used to it. You don't want to shock your body too aggressively. And then afterwards, you want to warm the body. And how we're going to do that is we have a steam room in the basement. So we'll go into the steam room for probably like 10 or 15 minutes. So again, the goal is between a minute to 5 minutes. So we'll start now. Here it goes. I'm going to talk my way through this because it's going to probably benefit the process distracting me. So here I go. And again, I'm just getting my legs in at the moment. I'm going to actually try to sit down because so I don't have to move, because when you move, then it becomes more problematic. So I'm sitting here right now and I'm feeling some aggressive tingling throughout the body. Thinking warm thoughts, but just trying to think of the benefits of what's actually going on right now. We're getting a constriction of blood vessels. Now, inflammation is important to the body because it heals damaged tissue. And as I said earlier, when you're working out, you're breaking down muscle fibers, which is actin and myosin. And those fibers are what create the contraction. So as you resistance train, you're actually breaking down tissue, and the body's way of healing is through the inflammatory response, where it brings nutrients, oxygen, and nourishment to the tissue. So that is a good thing, but the body tends to over-exaggerate the healing process, and that's where we get the aggressive swelling. So swelling from the point of working out isn't the same swelling that you see visually with like a sprained ankle or a sprained joint, because it's more deep within the actual tissues of the body. So this is really getting down into the heart of the matter. And again, it's not that the inflammatory response is damaging the body, it heals, but this is actually helping to reduce the pain mechanism in the body. So tomorrow when we're back actively training, we can not be as aggressively sore. So it's starting to acclimate. I don't know where I'm at as far as time.
2:48.
2:48. Okay, so I'm going to try to stick through the next 2 minutes here. But I can definitely feel more of the, I guess the discomfort is occurring in the lower calf and ankle area. And I think that that's just because of the way I'm sitting. I should probably maybe sit flat, but I'm afraid to move because it's going to be pretty tough to do that. But what I have been experiencing this last week is some knee discomfort on the right. It's something that I get when I start to push my cardio running, and it's at the top of the patella. And then I also noticed the other day when I woke up, the posterior of my left knee was inflamed and my knee felt really stiff. But I iced it yesterday and I did some other some basic stretches, and it actually feels pretty good today. It feels a little bit tight, but definitely much better. Right knee felt good today at the gym. I did a cardio workout again because I have to do it 6 days a week right now, and for about an hour. So again, I'm really hoping to feel the benefits of this tomorrow when I'm in the gym. I'm actually feeling pretty good right now.
You're just at 4 minutes right now.
Looking forward to going into that steam room, I'm not going to lie to you. But again, they say anywhere 5 minutes would be I think pretty darn good for the first time. We'll continue to increase it. I think we'd like to do this maybe once a week, just to again help with the body's healing process. We'd also like to do some compression therapy at some point, and probably do some massage therapy today as well. Get some chiropractic adjustments, of course, to help realign the skeletal structure of the body, allow the nerves to function properly.
Seconds.
And
about 25 seconds.
So 25 seconds, actually I'm feeling pretty good. So I could probably stick with it a little bit longer, but I don't want to overdo this. Again, I'm feeling comfortable. Try not to move, but
5
overall,
seconds.
not too bad. So I think I'm going to call it at this point, and we will let you know how it worked out. This is Dr. Mike signing out.